In the United States, there are lots of people take some prescription drugs. My family, one of my family also takes prescription drugs too. Um, but those cost of prescription drugs are much higher than other country in the US. Indeed, according to NBC News, September 26th, 2024, they said uh, 33% of Americans cannot afford their prescription drug prices, especially African Americans and Latinos are struggle to pay their prescription drugs. Today, I will argue about the insane cost about prescription drugs in United States, and I will discuss about the problems and the cause and the solution about this problem. The problem is those high increases cost of prescription drugs are threats to the patients and every taxpayer who living in the United States. According to American Hospital Association, May 22, 2024 said nearly 30% of Americans says haven't take their medication and medicine because of high price. And also, the institution estimated that more than 1.1 millions of patients could be died because of they can't afford their medication. Also, according to KFF Research Center, October 4th, 2024, they said 30% of patients takes medicine help needs a help to afford their medicine. So 1/3 of American patients are actually their lives are danger because of the higher prices of the prescription drugs. Then what is the cause of those drug prices? According to Psychology Today, March 11th, 2024, they said they provide four reason that increase the drug prices. First one is there are no central authority. In America, uh, they don't have a government department or some kind of institute to control the prices. And the individuals like local insurance company or patients are negotiating their drug prices. And also, probably the patients and local insurance have no power to negotiation with the big drug company. Now also the incentive system, this make vision to sell higher cost of drugs. And it means the drug companies charge as much as they can that market will bear. So the company there are no authority and the company want to expensive drugs for their benefits. And this problem is uh, not only for the patient who takes drugs. According to Hospital Primaries Journal, accessed in November 12th, 2024, says it can be some impact. It can impact to every taxpayers. So, like me, the every taxpayers should be paying for those higher prices. Then, what should be the solution of this problem? According to Reuters, September 3rd, 2024, they said make some authority to control prices. And in practice, the Biden government started to the first negotiation department to negotiate with the drug companies to reduce the budget of medication. But it is not enough to right now. And there are also other opinion about this. The Jacobin Journal, January 10th, 2024, they give some example of Canada institution, which is PMPRB. This institution is like have a same role as the FDA, and they have a more authority to regulation the drug prices. I just I was discuss about the problems about the prescription higher expensive drugs and cost of these expensive drugs and how to reduce the cost uh, that these prescription drugs cost compared to the Canada. And I hope no one worry about the drug prices, especially patients rely on the prescription drugs. This crisis is critical to our minority neighborhoods. And just like I said, the African Americans and Latinos are more vulnerable to these issues. And we have to focus on this issue and claim to the people and the governments to solve these problems.